is actually having somewhat of a control to that. You also have a respiratory center, which is actually influencing the rhythm of your breathing. Remember what I said earlier, it actually has influences by oxygen levels, okay, or carbon dioxide levels. So basically, that's one of the things we have. It also has messages that go out to the cerebellum. Let's talk about the cerebellum real briefly, so you have an understanding why it's so important to have that connection. The cerebellum is actually related to muscle coordination, muscle movements. Anybody ever try a sport? Who tried a sport? Karen, you tried a sport?
Yes.
What sport?
Tennis, basketball, and track.
How did you play the first time you ever played one of those sports?
A little uncoordinated.
Okay, that's understandable. All of us, including my son, when he was first walking, you know, it's uncoordinated, and then it's muscle activity, and I want you to realize. And just, you know, typically when we're looking at it, it's the cerebellum that actually identifies sensory and actually has that, I'll call it hand-eye coordination type thing, which gets you to learn how to adjust the muscles that need to be triggered to actually get that smoother.
That's where occupational therapy would come in, right?
Yes.
Fine and gross motor skills.
Yes. Okay. So that's where I want you to realize it has to come through the medulla oblongata to go out to any place. But this is one of those areas that you also see it. So basically everything goes through there. You'll also notice reflexes will actually occur like Chris just demonstrated just a moment ago.
What? Demonstrated what?
You demonstrated.
I demonstrate a lot of things daily.
Yeah, you sneezed.
Sneeze.
Oh, cool, okay.
Okay. So that also comes from the medulla oblongata.
Oh, okay. Cool.
Even though you didn't realize that until afterwards. Okay? A lot of times when we look at it, we can look at different parts. So I'm going to actually show you this one. I don't know if I'm going to put it back there because it's just a little bit too back and forth to do this. But you'll see on the ventral surface, we actually do have pyramids. Pyramids basically, what do pyramids really indicate? Or what do we usually see with a pyramid? What shape? Triangle. Good. Excellent. So that's all it means. We also have, motor tracts in this portion. We also have where we desiccate fibers. Desiccation of the fibers basically means it reverses sides. So whatever is coming down or up from the right side of the brain switches to the left side at this junction. Okay? This is why they usually talk about your right brain controls the left side of the body and vice versa.
Also, like when someone has a stroke on the right side, it affects the left.
It affects the left. But it also depends on what portion is affected. And we'll get to that later on. Okay, so I want you to realize. And it's mostly motor. Okay, in other words, muscles, where we're actually looking at this. We also have what's called olive, which is basically other nuclei, which are basically in proprioception. Proprioception, I want you to think about this. I want you to, here's an exercise, stand up. Go ahead, stand up, close your eyes. We're gonna do one of those exercises that they do at those nice, all these stops where those nice, lovely
Oh, I
gentlemen
can't do
with
that.
the,
You gotta
with
look
the
up
lights,
and-
those flashing lights, like to do.
Yeah.
Okay,
But then
close
I'll
your
have no point of
eyes,
reference.
put your arms out, touch your nose.
With what, both of them or one?
You decide, okay? Now, I want you to realize proprioception is actually identifying positioning of your body. It's actually looking at the muscles, how they're contracted. It's looking at the pressure at the joints. It's looking at the tendons to try to identify your position of your body. You guys can open your eyes now, Chris. Okay, I know, he was doing all kinds of stuff. And that's fine. But I want you to realize this is actually where it's actually identified. Okay? You can actually be in complete darkness and know exactly whether you're sitting or standing because of that. Or whether you placed your hand out or you did not. Okay? So proprioception is the sensory to actually identify these types of signals. It also,
Is proprioception also linked to the surrounding environment? Like
Yes.
in sense of zero gravity, do we still possess proprioception?
We do. We do, because we still identify where we are, okay, as far as which muscles are contracted. Now, it's a little bit challenging in zero gravity. Why? Because gravitational pull does play a role with it, and it's a little bit harder to detect, okay? That's where they've done, NASA and other space agencies try to test out these concepts and see what goes on with it. We also have precision movements. What does that mean? That's basically fine motor skills, like handwriting, typing, piano playing. Those are all fine motor skills, okay? And we'll talk more about that also, all right? We also have the dorsal side. The dorsal side, on the other hand, will actually have more sensory. And not only that, that's where we actually find 5 of our cranial nerves coming out on the dorsal side. Now, I'm going to say this one time, or maybe I'll say it more than one time. But one of the things you'll notice is that you're not going to be needing to actually pinpoint which cranial nerve is which on a diagram. Okay?
We will not?
Will not. Okay? Will not. Okay? Did I say that enough times? So when you're looking at this brain, I will not ask you what cranial nerve is this. Okay?
Okay.
But you have to know which cranial nerves do what, is what I'm going to say. All right?
What about the components?
Which one?
The components.
What do you mean components?
Like where it's coming from? Like is it sensory? Is it like autonomic?
Yes.
Okay.
Because when we're looking at cranial nerves, they're going to either be one of 3 possibilities. They're either going to be sensory, or motor, or mixed. Remember, spinal nerves, or all the spinal nerves, they are all mixed. But cranial nerves vary. And that's what you need to know. Because if you know that, you'll know something about what it's doing. Okay? Because when you should know something about what it does. Okay? But we're going to go over those. Okay? Cranial nerve number 12 is the first one we're going to talk about. That's hypoglossal. This actually controls tongue movements. So it actually is involved in speech and swallowing. You guys ever swallow?
No.
It's not like a bird. Bird swallow. The bird, the swallow bird. Alrighty. And what we do see, it is a mix because we have sensory. Because if you guys ever notice when you're actually talking, you actually project your tongue in a certain way, and you actually identify the position by what's touching, and then you actually try to adjust it according to what you need to actually make a particular sound. Does that make sense? So that's why it's mixed. If it's wrong, or something's gone wrong with this nerve, and this is why. How many? Just remind me. How many of you going into nursing? I want you to realize that when you do physical assessments, one of the things that you sometimes have to do is do a physical assessment of the neurological aspects. What's going on with the patient? Understanding what nerves and what the abnormalities are with as far as symptoms with that patient, helps you to identify which cranial nerves may have a problem, to help us understand where we have to test out and get confirmation on. Okay? So you'll see the tongue sticking out. You know, something where it doesn't look right. You guys want me to do that again, just to make sure you have that?
Yes.
We should look at that, but sometimes in a patient, I noticed before that in the past, when some of my patients would over-medicate it,
Yeah.
they would get like that.
Because it would actually affect the nerves. Think about how many times you may have actually gone to the dentist and they numbed your face side and you don't feel the tongue, and it kind of, you get
So they say
la
don't
la
eat
la
it,
la,
don't eat it.
you know, when you're speaking. Okay, so it happens. Okay, cranial nerve number 11. You guys remember how to do cranial Roman numerals? I just want to make sure. Anybody not remember Roman numerals? Okay, cranial nerve number 11, spinal accessory
I'm
nerve.
just doing like
This
highlights.
one has two portions, one's spinal, one's cranial. I do want you to realize this actually affects the throat, soft palate. It also affects your trapezius muscle and your sternocleidomastoid muscle. Okay? So this is mostly motor, mostly. Okay? Cranial nerve, go ahead,
1 second.
go ahead, I'm sorry.
I have it here too if you wanna, I can post it. So.
Okay? Cranial nerve number 10 is one that probably you guys have actually heard of. You might be familiar with. It's the vagus nerve. This is the one where if you put down a certain amount, you might win big at Las Vegas. Wrong. No, the vagus nerve actually affects your upper thoracic cavity. It actually can control the heart and affect it. It affects your visceral muscles of your thoracic cavity. It has sensory, it has motor aspects. The vagus nerve is one that a lot of people think about because of the fact that it can actually have issues as far as the, when we're looking at the heart and the breathing mechanism. The vagus nerve is the one that gets affected when we try to do general surgery and try to inhibit the function of the respiratory tract during surgery, so we can actually intubate somebody and make sure that they actually get external respirations, okay, controls.
It's about
The vagus nerve, yes. Okay. So this one, we hear a lot that way.
So this is sensory or there's the motor because it controls
It
the,
is
the muscle mixed.
because it does have sensory and it does have motor. Okay.
And now, is the accessory nerve also mixed, or is it only solely motor?
It is
Because it's primarily
mostly
muscle.
motor. There may be some sensory, but the sensory is not as
So would you put it down as a motor?
I would
Because
say it's motor.
primarily, so
Yeah.
on a test there. Okay.
Number 9, glossopharyngeal. Glossopharyngeal, this is actually also affecting swallowing,
Yeah.
okay? It also is affecting your parotid glands. It also is involved in the posterior third of your tongue. So it has a mixed aspect because of that. So you have sensory of the posterior third of the tongue, and it also affects muscles. I'll say that.
Secretions of parotid.
Okay. Number 8.
So I just have a question. Could
Yes.
it controls secretions from glands. So like if you had if you had some sort of damaged that nerve, could you not excrete like any
Yeah.
at all? Like you wouldn't get that
It may
that
not secrete at the normal
enzymes
levels.
or any.
Okay. In other words, keep in mind, you may actually have pressure from other sides of other muscles that are around it
Okay.
that may squeeze it and may actually allow some of it to become out, but it wouldn't actually have the muscles of the parotid gland to actually squeeze the parotid gland to release it.
Oh, interesting. Okay.
Okay.
So mixed.
Mixed. Number 8. Number 8. Vestibulocochlear. Vestibulocochlear. This used to be named something else, by the way. This had a different name at one point in time. But basically it has two branches. It has the cochlear branch and it has the vestibular branch. The cochlear branch is coming from the medulla. The vestibular branch is coming from the pons. Okay? So everything's not always clear cut. Okay? As far as the brain. The cochlear portion is actually involved in the perception of hearing. You actually, it's going to that portion of the inner ear. If it's damaged, you can actually get deafness, you can actually get tinnitus. Tinnitus is basically ringing your ears. Anybody ever get ringing in their ears?
Yep.
Okay?
Even with tinnitus, that's ongoing, even if they're not in a loud place,
Yes.
Yep.
nothing stops it.
Nope.
I mean, you usually expect tinnitus you might experience from a loud environment afterwards, like you go to a concert or some sort of event like that. But tinnitus can also happen more long term. And it may be an indication of nerve deafness. So that's why. Yes? I'm sorry. Hold on.
Did you say why you might get it randomly?
Generally, a lot of times it's happening when you're in a large sound environment,
Okay.
and that's where you might actually experience it. Okay?
That's not really loud, but it does happen. I don't know.
Yeah.
Randomly.
Well,
Very rarely, but randomly.
random. But it does happen, and I hate to say, but a lot of times it may be related to where the triggers of the sounds are just so much. I know a friend of mine, he apparently has, he worked in a factory type environment for years. Currently he has, I think, 30% loss in one ear because of the environment, the noise, for the extent that it was in that environment. So a lot of times I'll talk to him and he doesn't hear me if it's on the wrong side. So I have to repeat myself from the other side, So it happens, unfortunately. The vestibular branch is where we actually go through the vestibule. This is where we actually get the other portion of the ear, the inner ear, which is looking at balance. That does not mean you're trying to balance a computer on your finger, okay? It means body balance, which means there's two types of balance. There's rotational balance and there's linear balance, basically, or what's known as static and dynamic balance. You guys ever get stopped at where those gentlemen with the flashing lights stop you? You have? The demonstration we did where you're touching the nose, sometimes that's also related to balance in some way, okay? But they usually also have you walk a straight line and that kind of stuff. And basically, if you're thinking about it, if you're able to stand straight, that actually is related to your balance without wavering. You ever see somebody come out of a bar and they're wavering? Okay? Part of their balance. That's not completely accurate at that time. Vertigo can actually happen with this, which is basically, anybody ever get where the room feels like it's
Spinning.
You know, that's what it is, basically. Some people get it when they drink too much, some people get it when they have certain medications, some people,
Certain rooms can give it.
Yeah.
Just being in a certain room can give it to some people.
I remember when, when I was little, spinning in a chair and people are spinning around and around and around was a fun thing to do, but now it's not that much fun. Chris, you do it all the time?
Huh?
Spin?
It's my favorite pastime.
Yeah, I
Mostly in
figured
circles.
Let's make sure you get vertigo.
So rotation and linear balance, can you just put that in perspective, like the differences between the two?
Yeah, so in other words, the one actually is related to just having the ability to walk a straight line or being stable. The other one is when you're moving to actually also have that balance.
Oh, so really just their namesakes between
Yes.
linear and rotating?
Yes, yeah.
Okay.
I mean, they're actually
They're not two
officially known
separate-
as static versus dynamic.
Static versus.
Static, whether you're standing
Standing
there
up.
and able to have balance, as opposed to when you're moving. Okay?
And there is a difference when you say that vertigo, when you feel that the room is moving or yourself moving.
Well, if you feel like the room is spinning, that's vertigo.
Okay.
There are people that, and I want to say this, that there are people when they drink too much, sometimes that happens. Have
So-
you experienced that?
So whether.
Me?
Yeah.
Yes, long time
Yeah, a
ago.
long time ago. Okay, long time ago.
Long time.
Long time ago. Okay. So it happens.
It happens.
Okay.
In the good old days. So vertigo is classified whether or not it's from external source or
Yeah,
medical condition? Doesn't
yes.
matter.
So, okay. And there are patients where certain medications will actually cause you to have vertigo.
So what is this nerve actually controlling that allows
It's
that causes
identifying
balance?
sensory.
Okay.
Sensory, because basically the sensory aspect is identifying whether there is, and we haven't gotten to this, but you actually have movement of fluids in the inner ear.
That's what's
At
like
the,
fluid in your ear. I
yeah.
know, like some people
And so
puncture that and like.
but it's
lose
not
it.
the fluid you're thinking. There's three different aspects. We're talking about where there is fluid there and it's moving in there in the inner ear, and that movement is actually being detected. And you're perceiving it as far as whether or not you're standing still or moving, and you're able to then identify what's going on. When I went to that, I think I mentioned to you guys that I went on a hydroplane boat, which was called the Ferry, going from Athens to Santorini.
Sounds cool.
Yeah, it was nice. It was nice. It was high speed. It took half the time from a regular ferry. But they had there were people that were on the boat that were hired by the line to give out barf bags all day. Because that's related to vertigo and balance. You ever walk on a boat and you're walking in
Yes, and then, yeah.
You know, sailors, they actually walk this way when they're on land,
Oh, it's nice.
sea legs. But you know what it is? If you think about it, they're so used to doing that on those types of ships. And if you remember, you guys probably don't, or maybe you're not aware of it, but the British Navy, when they had the tall ships, they used to pay their naval sailors and officers in rum.
Ah, commodity.
So that kind of, you think about it. You drink a lot of rum or any kind of alcohol, what happens? It affects your balance. If your balance is, wavering, guess what? If the ship's going like this, what's going to happen?
You're gonna
Gotta go
run
with
it.
You're going to just roll with it.
So, jump and.
Yep. And think about this. To give you another line of this, you always hear about pirates.
Yeah.
Pirates at one point in time were ships that may have been naval ships that were there to actually affect opposing nations. Unofficial. Because there were big ships that were going from the Americas back to Spain with gold and silver.
Of course they were. Taking
That they
away
were taking from
gold.
the native peoples. But then what was happening was British ships were then pirating them.
Intercepting them.
Yep. Even though they were not, quote unquote, official in the British Navy. Interesting history.
History.
Yeah.
Marvelous,
History has some interesting things. And lack of coordination happens here too. Okay, so known as ataxia. Now, injuries do happen in the brain with the medulla. Typically, in the movies in the 1940s, they used to show people getting whacked in the back of the head and passing out. 1940s. Okay. Remember, movies are different than reality sometimes, but in all reality, it can actually be fatal. You could kill a person.
Now, a hematoma can happen anywhere in the brain,
Yes.
but now if it happens in the.
Hematoma can happen any place. Remember what a hematoma really is. It's a bruise, internal bleeding.
But when they say like a hem, like you ever watch
Yeah.
Law and Order SVO, and there's like a rape
Yeah.
victim, and they're like, blunt force trauma.
Yeah,
hematomas and
yeah.
that and stuff like
Yes.
that. So that would just be in
Any
any
place.
portion.
Yeah, so it happens. Hematoma can also happen because maybe the person had a cerebrovascular accident, which was a hemorrhagic type, which is basically what I usually refer to as a wet stroke, which means you had bleeding. Okay. And it depends where it's located. If it's a major artery or a minor artery. Major, it causes more damage, it could cause death. Minor, there may be loss of some functionality, it may not be even noticed.
But talking about the brain, can
Yes.
be inside of the brain and then outside in the meninges, right?
Yes.
That's the
Okay.
difference.
Yes.
Can you explain aspects of concussions?
Yeah, we're gonna get to them.
Oh.
We're gonna get to concussions.
Great. It's,
Okay, so basically you can actually lose function of the cranial nerves of where it's actually damaged. Specifically, if we're looking at the medulla, it can affect breathing and it can affect the heart rate. Okay? Pons. Pons, okay? This is a little bit more superior to the medulla. Take a look at your model. You guys have a model, right?
What? Yeah. What happened? Yeah.
Right, Chris, you have a model to
I
help
had a
you?
model.
Yeah. The pons is a little bit more superior. It also has more cranial nerves. One of the things that we see, it also has tracts. So it has an extension from the medulla with the tracts. It relays messages. Some of them will be voluntary skeletal messages going from the cerebrum to the cerebellum. Some of them will be, we also have things like the pneumotaxics and the epneustic areas, which are basically respiratory centers also. You'll actually notice this is actually controlling the respiratory, which may be more affecting sleep. You guys ever notice that there are some people that fall asleep regularly when not in times that they expect to? I'll say it that way.
Oh, like narcolepsy?
Narcolepsy?
Narcolepsy, yes. Okay, this is where we would actually see this affecting. It's basically the breathing that's actually affecting that.
Is it labored breathing, or?
Not always.
Not always?
Not always. It could be, but not always. Okay. We also have a couple of cranial nerves. You'll notice that some are, we also should see some that are similar to what we saw. We actually have 5, 6, 7, and the vestibular branch of the vestibulocochlear. So when we look at it, the pons is only about 1 inch long, by the way. It's mostly white fibers, okay? And we do get sensory messages that go there to actually affect the cerebellum. Okay, so let's get to the cranial nerves. We already talked about 8 with the vestibular branch, so we're not going to repeat it. But we have number 7, facial nerve. Where do you think that affects?
This.
Excellent. The name implies what it does. This is a mixed one, by the way. It does affect the facial muscles. It affects the mucous glands. It affects the tearing. It affects salivary glands. Okay, as far as motor functions. Sensory, it's affecting the anterior 2/3 of the tongue. Okay, so it's involved in taste, basically, if you're thinking about it. Yeah. Number 6, abducens. Basically, this is affecting the lateral rectus muscle of the eye. Let me give you an idea of what we're talking about. This one shows the muscles. We have a couple muscles here. We have, hope you guys didn't see that.
See what?
It was looking at you and it just fell apart. What happens is you have an inferior, you have a superior muscle, vastus. You have a lateral and medial. You have also 2 other pairs of muscles, which I'm going to mention real quickly. Well, the one that we're talking about specifically is the lateral rectus muscle. So this is where it's made basically motor. Okay? Let me see if I have an eye and a face. I don't think I do. No. So basically what this does is it affects the movement of the eye going laterally. When it contracts, it would actually cause the muscle to cause the eye to move more laterally. But here's an interesting thing. When you're actually looking eye to eye, when you move your eyes, they move in sequence in that direction. So what happens is, if the lateral rectus is not contracting, one eye is, but the other one is not. So this is what we may actually describe as cross-eyed, because there's a weakness. And I've seen people with this. You're looking at them, and they're just looking at you, and one eye is towards you, and the other eye is someplace, who knows where.
Is that controlled by sensory as well? Because, what if when you cover one eye and
Not
able to
generally.
move it?
Not generally.
Okay.
But a lot of times to correct it, we actually do cover to try to actually increase the strength. But that's medial rectus, not lateral.
Okay.
Okay. So, and there is I will say this, with cross-eyed aspects, there can be genetic factors. Okay. Number 5, trigeminal. This is mixed. We have the motor portion, which is involved in the muscles for mastication. You guys remember what mastication was, right?
Chewing?
Chewing, good. Okay. Just want to make sure. But we also have sensory, which is actually affecting of the face. Touch, pain, temperature effects. But you'll notice there are 3 branches of it. Notice the name, trigeminal, 3. Affecting 3 portions. So what are the 3 portions? Ophthalmic, the eye. Maxillary, where you have your upper jaw. And mandibular, the lower jaw. This is where you actually, anybody, I don't think anybody's going to dental areas, are they? No. You? No. Okay. Remember when you go to the dentist, they actually give you pain meds, and it affects one portion of your jaw or your face. They're trying to affect that one branch, primarily. That's why you'll actually notice they're working on one tooth, and you feel it all throughout that whole side. Okay? Because they're actually affecting those nerves. Any questions about the pons? Okay, we're going to go on to the midbrain. So the midbrain is also about 1 inch long. You notice these are not small portions. They're large parts. They're very tiny, relatively speaking. And it extends from the pons, but it actually connects to the diencephalon, which is the next part we're going to look at. Okay. And what we actually see is, if you're looking at it as this shows, here we have our 4th ventricle, and then we have our 3rd ventricle, our connection to the 3rd ventricle, from the 4th ventricle. The midbrain, if we take a different section of it, we would actually see something that looks like this. Now, what do we actually see? We have clusters of motor and sensory, which is known as cerebellar pedicles, which actually connects to the cerebellum, cerebrum, excuse me. We have what's called the substantia nigra, which is actually subconscious muscle activity. We have the red nucleus, which has red blood supply. This is where it can actually connect with the blood supply, which changes it to a red color. And it actually sends messages out to the cerebellum and the cerebral cortex for muscle activity. So basically, it's actually involved in transmitting these messages and connecting. When we look at the dorsal side of it, we will actually see what's called a, I'm not even going to give you the name, don't even worry about it right now. But basically it's involved in eye movement coordination based on visual stimuli. That's what's actually affecting your eye movement, Chris. Okay? It also affects you as far as your auditory. Meaning, you hear a sound and your head goes toward that sound. I have a friend of mine, he used to be, years ago, he used to do EMT for a while. And even when he wasn't doing it, this moment he heard a siren, he'd turn his head towards it. It would just, like clockwork, just go right to the signal. But you might also notice other types of sounds will actually affect you in that way. So, you know, it's just, this is the portion of the brain that actually is involved in this.
Is that conditioned?
What's that?
Is that conditioned?
Somewhat, because remember, we actually have 2 factors going on. We have the sensory aspect, which then coordinates as far as what that represents. Okay? So when we're looking at it, there is a cognitive portion and there's a sensory portion, okay? A perceptual portion. Okay? when you guys hear a siren, it usually represents something as far as emergency medical or along those lines, that you then coordinate with that. But if you have a sound and you don't know what it is, you may not have an actual representation of what it means. So that's where it becomes a little bit less likely to, you know. But you may actually turn your head to try to find out what it is. Okay. So let's talk about the cranial nerves that are involved in your midbrain. Trochlear. Trochlear nerve affects the superior oblique eye muscles, which actually turns the eye on the superior side. That's basically all it does. So it's motor. That's number 4. Notice we're coming down to the list quite fast. Okay? Number 3, oculomotor. Oculomotor affects the other muscles. It says 4 extrinsic, which means the other 4 muscles that we haven't talked about, and 2 intrinsic, which means inside the eye. What do the ones that affect the inside of the eye? The ones that affect your pupil, which is related to the ciliary muscle of inside the eye, which then affects whether your pupil is dilated or constricted. Also, it affects the lens, how you focus.
Is that muscle as well, or is that just a nerve that controls the pupil dilation?
Well, it is related to a muscle inside the eye. It's actually the ciliary muscles of the eye. One actually is more directed with the iris and the pupil. Let me try to give you that eye image again so that it really helps you understand it. Maybe this one would be better for that. So if we're looking at the eye, nice eye, we don't need that part. We don't need that part. This is the part we need. Here's our muscles, okay, inside the eye. And so what happens is it actually coordinates with the iris right here, which then affects the pupil, how we relax it or how we constrict it. Okay, so that affects that. Not only that, it affects the lens, which then actually allows us to stretch it out or to actually relax it so we can change our focus on an object. Okay, so that's where we actually, it's related because it's all in the same area of the muscle, but it is a little differentiated. Okay, not only that, it also affects the eyelid. Okay, so you also have the eyelid muscle being affected by the ocular.
So this is going to be primarily motor?
Motor, yes.
And a trochlear nerve? Would that be motor as well?
Yes. Okay. So let's talk about what this thing is called reticular formation, which is basically of these 3 parts of our brain stem. Our reticular activation system is basically how we stay alert and awake. How does that happen? From senses. Think about it. You have, you get something like, I'll give you an example. If you smell smoke. Anybody ever smell smoke?
Yes.
Does it smell good? You don't want to smoke? Okay, all right, that's fine. But if you,
Oh my God.
yeah, he's differentiates on that smoke. Okay, but if you are asleep and you smell smoke, it's going to wake you up as far as trying to identify what it is. Hopefully. If you like the smoke, well, I don't know what's gonna happen with, you know,
Right.
you'll sleep right through it and say,
Enjoy it.
this dream is so nice, I smell the smoke.
Open
I don't
fire.
know.
There-
So, yes.
But I thought reticular formation doesn't have like smelling senses.
No, it doesn't actually, but what happens is it relies on the different senses that actually can affect it, okay? Just like if you see light. You know, did you ever have a overnight shift? You know what I'm talking about? Where you sleep, where you work from, let's say, midnight till 8 o'clock in the morning?
Yeah.
It's horrible because you're there. When do you sleep? During the day.
I didn't.
Yeah, it keeps you up because you're used to having light to keep you up. Okay, that's why. So light will actually affect you.
Is this where the term of like a biological internal clock comes in?
Yes. So well, kind of, but not exactly because
Again,
we do
conditioning.
actually have a sleep-wake pattern that we typically have based on the light and darkness. This is one of the reasons that typically in the winter, or I'll say not in the summer, that you change your sleep-wake pattern based on the amount of light that's actually when the sun's coming up. Okay. Did you guys ever notice that it's easier to get up when the light is coming up than when it's dark?
Yeah. Is it vitamin D? Is it-
Well, it's not the vitamin. It's just in general. I'm talking about. Yeah, it does, but it's not exactly that portion when you're waking up in the morning. Okay.
It's the
You-
circadian rhythm.
What's that?
Circadian rhythm,
I'm sorry.
the internal rhythm that our body has.
Yes, where it actually interprets what's going on based on the light that's outside.
So,
So.
if somebody was to not have any of these preconditioned experiences of, let's say, night and day, they just happen to, somebody says you wake up when it's dark, would that still be a stimuli to this receptor?
Yeah, it would. And it's not a receptor, it's
Or-
just a coordination of all the different senses that are then continuing to actually, let's say, keep you alert and awake.
So what is it that's actually reaching them?
Well, you have the
From the
sensors,
senses, from the
they're
external
being
senses.
interpreted
Okay.
in this section, and then basically causing you to become alert and awake. Okay? If you have certain sensations or sensory messages.
And those sensory messages are based
They're
on people's
basically, if you actually have smell, or you have a sound, or you have a certain amount of light, or other sensations, stimuli, in other words. Anybody uses an alarm clock? You do?
You,
Does it work? Does it help you to wake up? Yeah, I understand. Years ago, when I was younger, I had a clock radio, alarm clock.
Intensive winds come on. It was 22 minutes to give you the world.
No.
It was alarm clock was, and it was the one you had to line
it was like the brown one, the box,
Yeah, no. Mine was an actual, and it came on with, I don't know, loud music. Okay, loud music. Okay. And guess what would happen with me? It woke everybody else up except me, and I slept right through it, and it became part of my dream. The music. I remember going to camp when I was younger, and the fire alarm was right outside my door, where my room was. I slept right through the fire alarm. At the time, so I slept right through it. Nobody even. I found out at breakfast. Yeah, that makes me feel great that somebody didn't even think that to check on me. So, but things like that happen. But that's the kind of things that the reticular activating system actually is there to actually try to get you more alert because of whatever happened. I'll give you an example. I remember driving, and sometimes I was driving, because my hours are, they varied. One time I was coming home, and I don't know what time it was exactly. It was late. I'll just say it that way. It was late. Okay? And I was dozing off, and a lot of times when I start to doze off, I pull over, I get out of the car, I walk around and try to get my muscle activity to try to get me awake and that kind of stuff. But this time I didn't. But something did wake me up. What was it? I got on the exit ramp, and right before I reached the exit ramp, this other car apparently crashed into the wall of the exit ramp. That woke me up. Having that, seeing that, because, I could tell because, lights were just on and all that of the other car. So, but I wasn't awake enough to stop. I'll say it that way. I didn't want to, because it was dangerous to stop right on the exit ramp.